New York City is set to begin hospitalizing mentally ill people involuntarily. Mayor Eric Adams announced the NYPD and outreach workers have legal authority to take individuals who appear to be experiencing a mental health crisis in for psychiatric evaluations. The new directive is sparking some backlash and debate about homelessness, mental illness, and how to tackle both issues. Clinical psychologist Jeff Gardier and former NYPD detective Mark Claxton are here with more on this. Jeff, critics say this move infringes on people's civil liberties. Supporters say it will help both these people in need of mental health care and the community at large. So, as a psychologist, what's your take on that debate?
Well, when we talk about involuntarily hospitalizing individuals, we have to be aware it's not about locking them up in a psych ward and they never see the light of day. It's basically that they are to be stabilized, get their medication, get therapy, get aftercare services. These are just extensions of what we've seen of the subway safety plan that connects people experiencing homelessness, continuous engagement between community and clinic treatment, and Kendra's law, which ordered treatment without ordering them into a hospital. But all of that being said, we do need to be careful on infringing on the rights of individuals with regard to their civil rights and to their liberties. So we have to be really careful with this plan.
Now, Mark, Mayor Adams said that officers will get training to identify people classified as, quote, in need. So what goes into this type of training?
This training actually has been instituted in NYPD since about 2015, and it incorporates some additional psychological or mental health training with professional psychologists, like psychiatric workers, et cetera, social workers. It incorporates many of the disciplines that are necessary to provide the proper amount of resources to individuals who are perhaps suffering through some mental health issues and items. And even though the training has been ongoing since 2015, and there are a number of NYPD officers who have received the training, operationalizing that training has been somewhat challenging. And it was even pointed out by the NYPD's own Department of Investigation several years ago. So what's happening now, I believe, is an expansion of the crisis intervention teams, which actually now will be more of a crisis aversion team, and really operationalizing the full use of all the disciplines, the psychiatric, the social workers, and the NYPD, the police, the law enforcement wing.
So, Mark, what are the pros and cons here as you see them, both for those taken into custody and for other community members?
Well, I think people should keep in mind that police have involuntarily brought psychiatric patients into hospitals for many years. It was quite common. It's referred to in the NYPD as addressing EDPs, emotionally disturbed persons. I think the focus in the past has been if that person represented or presented some imminent danger to themselves or others as the qualifying standard for hospitalization. I think what Mayor Adams has chosen to do is to expand it and include individuals who are failing to meet their basic living needs. And as he indicated, it's more of a humanity approach to it. It's more dealing with the issues that the person may be experiencing and providing dignity for those who are obviously in need of professional services.
And Jeff, I'm out of time, but quickly, I want to ask you, is there anything else you would like to see done to address this issue?
Yeah, absolutely. I would like to see more of a focus around health and housing. I know the Coalition for the Homeless is really concerned about that. And I think we really need more training for the police and these people making the interventions on implicit bias, and as well as trying to prevent any issues in the future around lack of cultural competence, because we don't want to see Black and brown people being, overly approached as far as these issues.
All right, Jeff, Mark, thank you both.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.